The Jayadeva Institute of Cardiovascular Sciences, the place that has not just treated heart patients but has also gotten a lot closer to the people's hearts. I'm right now joined by the current director of this beautiful institute that is Asia's largest cardiovascular institute. He has taken over the mantle from the former director K.S. Manjunath. Ravindranath has taken over this. He is the former vice chancellor of Rajiv Gandhi Institute of Health Sciences and also a professor in cardiology. So very well deserved for you as well. Many congratulations for taking over as the director. Huge achievement for you. You'll be taking over from February 1st, sir. And one major thing that everybody looks out for is that you really have some really big shoes to fill, because the one, the director who was before you, Dr. C.N. Manjunath, he did some really good, spectacular work. He had only one policy: treatment first, payment next. So what is going to be your motto, sir? What is your vision for the institute?
Now, as you mentioned, Dr. C.N. Manjunath, earlier director, has brought this institute to not only national and international level. He has shown a government institute is no less than any corporate hospital level. And the main objective of this our government institute, nobody should go untreated. The quality treatment should be given to all grades of patients. They come to us. They come from all over Karnataka. Not only from Karnataka, even we get patients from the neighboring states like Tamil Nadu, Andhra Pradesh, even northern part of India. We get Kolkata, Jharkhand, Bihar patients. So most of the patients, 80%, almost 90% of the patients come from below poverty line. So these patients, because this is the only tertiary care in government sector in Bangalore, so we need to treat all of them. So majority have some this government scheme like below poverty line, that Suvarna Arogya Raksha, that scheme is there. So in that they get benefit. Some of them will not have any insurance cards. Even those patients, so will, because of want of money, we will not turn down. Wherever there is a need to save the patient, emergency cases, we treat them free of cost. That is the motto of our institute.
So one major contention, that is, when it comes to the realm of cardiology, even for procedures like a valve replacement or any other surgeries, there is a lot of waiting list. There are poor patients who go off to other government hospitals or other hospitals saying that the waiting list was too high in hospitals, given the fact that there is always a deluge of patients in Jayadeva, given the kind of hospitality that you offer. So in your tenure, what is the solution that you have to ensure that this waiting list that we are talking about comes down?
Yeah, obviously, the schemes, whatever there's schemes that are the tariff fixed by the government is not much. So that's why the private sector hospitals, corporate hospitals, they do not take this scheme. This scheme, whatever now there is a need for probably revision of this tariff, so that if the private sector also take some of these patients, the burden on the main center will come down. We, as you told, we have a huge burden. We thought, actually we started expanding to reduce this overcrowding and waiting list. So we started our Infosys block recently, and Mysore Jayadeva has been functioning, and Gulbarga. To some extent, we are reducing the number of workload on the main centers. Even then, waiting list sometimes runs to a month or two. For that, what we have done, we prioritize patient who requires an emergency. So where there is a urgency in the treatment is there. So we ask our surgeons to take them on a priority basis. Who can wait based on the patient condition? So we give them little dates. So there is a need to increase the number of OTs. Now even that's Infosys block, we have started now 3 OTs. So that is to some extent waiting list will come down.
So As you said that, building more district hospitals, let's say in Gulbarga or Mysore or in Hubli as well, that could be one of the main solutions. And that was the vision of your predecessor, Dr. C.N. Manjunath as well. He wanted to see an institute being set up in Kalburgi being operational before he left. Sir, in your tenure, do you have any more plans of expanding? I know, the burden of administration is going to be really huge because this is, this is really much complex than just said. Sir, what really is your plan? Will you be constructing more hospitals in more districts across Karnataka to ensure that healthcare reaches, cardiac healthcare reaches every single nook and corner of Karnataka? Do you have any such plans?
So now we have already, as I told, so Mysore is functioning with 400 bed hospitals and surgeries are done there. And Gulbarga now it is likely to start in couple of months. Almost 90% of the work is done. So there we can definitely, that part of, northern part of Karnataka, people used to go to Hyderabad and nearing, that burden has come down. So Hubli is started, may take couple of years. That is done by the government of Karnataka Health and Family Welfare. We are only technical advisors. So to start every district is a little difficult. You also mentioned there are so many administrative issues, faculty positions, monitoring, so many things are there. So it gets diluted. So my suggestion in that direction, also we have discussed with the government. Now we have government colleges in most of the districts, every district. There they have a full-fledged staff is there, all faculty, multi-specialities are there. If they start super specialties, cardiology, like nephrology, other, they can start. Then it can run smoothly. That is the motto. Rather than we trying to expand, now we are already because of number of centers we are expanding. So there is some little difficulty which we have practically come across. I think my suggestion is to start these specialty courses, super specialty. Recently, even Chief Minister has addressed and in the cabinet that probably we need to start all super specialty critical cares in most of the districts. So this treatment of cardiovascular diseases, especially heart attack, it is a time is very important. Time is the muscle. So they have to address the issues, MI, heart attack, these patients as early as possible. They say first hour is a golden hour. Correct. For that, now we have already started hub and spoke model. So now we have enrolled this Mysore, Jayadeva as a hub and neighboring districts. So likewise in Bangalore also, and other places we have it in one more place is there. So I think we have got 3 centers now. So hub and spoke model. Then that is Kalburgi. So the Kalburgi, Bangalore and Mysore hub and spoke model. Now we want to expand it to further. Now at least now they are already treating. What happens? They go to a peripheral center. They treat immediately because by the time they reach the main center, the muscle is damaged. Heart they can have complications. So in taluk hospitals, identified spoke hospitals, they pass on the ECG as soon as it comes to the center. There is an agency we have given. Immediately they will give the clot lysis. Once the clot lysis occurs, the lives can be saved. Then they will send to the, depending upon the patient, they can send to this hub which we have identified right now, Mysore, Gulbarga and this Jayadeva. That is going to be expanded to other districts.
So one main thing that the entire world is now looking at is the use of AI and even maybe robots for carrying out surgery. So for the Jayadeva Institute of Cardiovascular, which is Asia's largest hospital, sir, do we have plans of incorporating AI while while treating patients or even diagnosing them, or even maybe in the future performing surgeries using AI or robots? Do we have that plan in the foreseeable future, sir?
Right now, actually, the AI, that 3-4 studies are going on. One is in the echocardiography. You know, the echocardiography is to find out the heart functions and environment of the valves, damage, all those things were. So now one of our colleague is doing, based on the application, we store the images. The AI will give us precisely what is the actual ejection fraction, what is the heart functions and what are the diseases. That is one area. And even in the electrophysiology, our another faculty member is doing AI based, looking at the ECG, we can predict whether the patient has got going to develop any rhythm disturbances or what exactly the heart functions, and also they can diagnose the various heart muscle disease like cardiomyopathies, amyloidosis, and this under digital stethoscope. So these are the ongoing studies in our institute. Definitely AI is going to help us. It may not replace totally. Definitely is going to be useful and quick and precise in the diagnosis, and it will help to take care of our patient, management of the patient as well.
So one final question for Dr. Ravindranath. Sir, what is your big vision for the institute before your tenure ends, or however long you wish to carry out in your position as the director of this hospital? What is your big goal that you have, that you want to fulfill, that that you want your name and your mark on this? What is that goal?
Yeah, one thing is now the regarding the health services, the care of the patient is now is more or less stabilized. You have to see that the standard is kept up and should not go down. Maintaining the whatever standard that set by my predecessor has to be maintained. Number two, I am looking at some little more research activities. So we should start a more research wing. We have to strengthen. We have right now, but you have to strengthen it. And because we have a lot of clinical material, I think the publication of our work, what we are doing, should reach many people. Then only the academic activities should go up. That is our my thing. Of course, now the whatever the project that is to be completed, it should be completed on time. In that directions, we have to move together.
So for speaking to India today, thank you so much. We wish you all the very best and many, many congratulations for taking up this big role. Very well deserved, and huge congratulations once again.
Thank you.